Welcome back to the Non-Traditional Veterinarian. I'm Dr. Babanti. If this is the first episode that you are watching on YouTube or listening on Spotify or Apple, welcome. I want you to get cozy because it is really non-traditional over here. We talk about things that need to be talked about. And what I want to talk about today is what happens when nutrition doesn't work the way we want it to. What happens when the recipe formulations don't get us the results that we're looking for? What happens when the store-bought option, which we thought would be a good fit, doesn't work? What happens? What do we do? And I get it because sometimes it does happen that way. And that is because no two pets, no two dogs, no two cats are the same. And I actually think that's really freeing. And so, what I will say is that out of all the nutrition patients that I've helped, whether in a clinic or through consults, the record is really good on success and improvement. There are some that have had speed bumps along the way. And that's what I want to talk about today is like what happens when that happens? What happens when nutrition doesn't work the way we expect it to do? What do we do? And so what we do to start is we have a consultation. That way we can take a deep dive as much as possible into your pet's health. What has worked, what has not worked, and what has not worked, can we figure out why? Is it the nature of the food? Was it too processed? Was there other stuff going on in their life that was affecting their immune system as far as environment, chemicals, stress? Over vaccinating, over medicating, like what can we try and figure out and play detective on? And then what has worked? And then why do we think it has worked? Can we notice any patterns? And so we take a deep dive and then we talk about, do you have any records for any past gut microbiome testing or allergy testing, and how old are they? And that's important because if you've done allergy testing, great. What modality was it? What did it test for? And how old are those results? If they're a year old, things can change. And so we take this deep dive, we talk about again what has worked and what has not worked, and then we try and use that for our plan. And sometimes the plan includes, hey, I really think it's in the best interest for you and your pet to have a allergy sensitivity panel done, to have a microbiome test done. Let's loop in your primary care veterinarian as where they feel comfortable, and let's work as a team to try and get some answers. And sometimes some pet owners are like, I think that's great. I want to move forward with recipe formulation. If things don't work, then that's what I'm going to do. And I hear you. Sometimes switching the nutrition does help so many pets that we get where we need to be with just that. And sometimes even we do that, we hit speed bumps because nutrition is very, very powerful. It is also really powerful when it is individualized. It is really powerful when it is personalized and not cookie cutter for our pets. And so most patients that come to me, pets that come to me, they thrive on new nutrition. It's when we hit the speed bumps that we're like, okay, it's very easy to be like, this isn't working. And it's like, well, there's a lot of factors to this. Why isn't it working? That's the question I ask rather than it's not working, let's abandon it, let's scrap it. It's like, but why? Like you more than likely came to me for your pet's nutrition for a reason. And so this is unveiling a little bit more as to what is going on beneath the surface. And I'm like, okay, well, yes, I get it. We want food to work, investment, there's time, there's all these factors. Also, this is telling us more about your pet's health. Let's be, I don't want to say reactive. I hate being reactive, but let's be proactive, reactive right now while your pet's body is trying to tell us something isn't right. Let's get to the root cause of it. Because if they are eating highly processed food and things seem okay, that's only going to be for a little while. There are going to be side effects for it. Or if you've been cooking for your dog and you've been feeding him the same ingredients over and over and things are good, well, we also need diversity to the gut. That is a very isolated gut. And that is why your pet is probably not doing as well as we had hoped on the new recipes because their gut is so structured in isolation and bacteria because they've been fed the same thing over and over. And different bacteria need different ingredients to thrive, different fat contents, different proteins, different sources of fats. And so these dogs don't need less support. These pets don't need us to pull back. They actually need more. And that's where our collaboration as a team really is able to shine. That is where you as a pet owner and me as the veterinarian certified in pet nutrition really come together to problem solve and help us get over the speed bump because we don't abandon the plan, we dig deeper. That is the whole goal here. And so this is why I also offer email support with recipe formulations or as an add-on if you're like, hey, recipe formulation is kind of a tool in the toolbox that I'm not going to grab at this time. That is why there's email support. So if you're like, I'm going to look for something to buy, and based on what we've discussed, based on past history, maybe even based on allergy results, this is the food I'm going to try. And so I'm there to help be a tool in your toolbox as well, and to help problem solve and strategize with you on those. So that the back and forth communication helps you make more rapid, intentional, gentle tweaks rather than starting back from ground zero, rather than abandoning the plan and going back to where you were. Because to be honest, if you're going back to where you were, there's a reason that we met. It was either to elevate and make things better, or it's because things weren't great. And so I'm not saying is that my services are the end all be all. What I am saying is that there's a reason that we are meeting and that we need to really elevate your pet's health or really get to the deeper root. And that's where we come in as a team together to that because nutrition is not a one size fit all. It is not often a one and done thing. Now, I've had some patients that or pets that we change their formulations, we get them off processed food, we get them on less processed food, we make some tweaks and they thrive. But it is really intentional, and that's why I stay in your corner as well and give you that support as well. So, when things don't work, these are things we should consider. So there's a whole list of things. So there's protein, temperature, energetics. And this is going into a little bit of Chinese medicine. And what I'm not saying is I'm drinking my warm water. And it's not saying because this water is warm, although sometimes that can affect it. It's more so like how do these proteins or these carbohydrates or these fats or these fibers, how do they work on the body based on your specific pet? If your pet is, for example, warm seeking, meaning they are seeking out the warmth, then there's certain ingredients that we want to try and include to help nurture that. So are we doing that? And have their energetics change, especially the time of year or because we've corrected some things, their energetics can change. The fat levels, are they currently too high or too low for your pet right now? And so I have a lot of pet owners who come to me like my pet has to have low fat because of pancreatitis. And I understand. I totally understand because certain things there have been correlations. Also, is that because you've been told they need low fat because of pancreatitis? And here's the thing, when we do low fat, we have to replace those macronutrients to get us the calories with something else. And doing a whole bunch of carbs is not going to do your pet any service. And too much protein may not be ideal either. We're going to isolate the gut. So what we may need to do is nurture them because if they don't have proper bacteria in their gut that are responsible for breaking down bile acids, then they're going to have a harder time with fat. And then these bile acids aren't broken down and they get to the colon, they're really irritating. So it is a sign that something bigger is going on. And so we have to assess that. The fiber types, do we have a proper amount of soluble and an insoluble fiber? Do we need to add psyllium? Based on their gut microbiome, do they have too much bacteria that is fermenting or not enough, which is affecting the fiber? Do we need to add more fiber? Do we need to be a little bit fiber gentle and fiber conservative? And so that gives us more information on where your pet is and how can we get them to the place where everything is balanced and that ecosystem is really protected. Do we have hidden triggers in the foods, especially if you're doing a commercial food? Are there gums? Are there seed oils? Are there processed additives? What is in this food as well that could be irritating? Well beyond allergies or sensitivities. What are the additives added? In fact, the sensitivity panel that I really like doing, some of these additives are on there, are listed. And so it's very easy to be like, well, my dog can't have chicken or poultry. I hear that a lot. And it's true. A lot of pets can't have poultry. Now, poultry encompasses a lot. Quail, turkey, duck egg, quail egg, chicken egg, egg whites, whole eggs. There's a lot of factors to it. Pheasant. And so is it that they can't handle it, or is there something else in the food, or is it the perfect storm? I have a dairy allergy. I am also very sensitive to gluten and eggs. I don't eat gluten, I don't eat eggs. And so it'd be very easy if I ate something with all three of those to blame the dairy, which is very possible to be true. because I am very allergic, but it's also possible that it's the perfect storm because I have all these things that just don't do well with my gut. And so also looking at it as this is information. This is not failure. This is actually, again, I know that this can be a speed bump and we don't want speed bumps. We want to get to where we're going safely, quickly, efficiently. But this is also telling us that there's something else going on deeper rooted. And so we have to look at that. We don't abandon the plan. So what do we do if this happens? A, we explore possible allergy or sensitivity testing. Have we done it? If we have done it, through what avenue? How long ago was it? Are we feeding anything of the sort? And what's really cool about the test I'm currently utilizing is it not only breaks down protein versus poultry versus vegetables versus fruit versus grains and legumes, it also does chemicals, preservatives. It's got things on there as far as like cotton, down feathers, wool, plastic, rubbing alcohol, pollens, flowers, trees, insects. I mean, it is a really long list. And so also now is your dog being exposed to other things that maybe didn't have a chance to manifest, or do we have multiple allergens? In fact, just a few weeks ago, I got an allergy report back from a pet, and this dog is moderately allergic to glucosamine, highly allergic to plastic, highly allergic to rubbing alcohol, has some food allergies. And so it's like if all these other things are being incorporated into their lifestyle, this can show up in a variety of different ways. And so we use these tests as pieces of the puzzle. They're not necessarily the whole picture. And how we interpret them is really, really important along the clinical symptoms, not just instead of them. We also, I would say, leaning on microbiome testing. Is there an imbalance? Like I talked about, if there's not certain bacteria, your pet can't digest certain ingredients, and not just literally like beef versus pork, but certain types of like protein. They don't have a type of bacteria. They can't really utilize fiber. They're not producing short chain fatty acids, really important in inflammation. Again, they're not converting those bile acids, which can get to the colon, which can be really irritating. So, do we have a gut imbalance? Really simple tests that we can to determine that. In fact, if you've not listened to episode 24, where I talk about these non-traditional tests, I invite you to listen to that, and where I go over all these tests, what they do, really, really valuable. And so I may suggest doing a microbiome test. We can determine if there's dysbiosis. We can determine if the ecosystem is altered and how can we repair it. And the really cool thing is when the results come back, they're unique to your pet. Is it a diet change, which almost all of them are? Is it rectal ozone? Is it fecal transplant where we can do either capsules, or we can connect either if we're local to each other, or I help you find someone in your area that can do it rectally. So we talk about really a variety of different ways. Do we need more fiber? Do we need more probiotics? Like, what do we need to do? Or is the gut such a wreck that I'm like, this is so off that there's something deeper going on here? And then what is that deeper? Is it from being on processed food for years and years and years? Is it from getting vaccines every single year, a distemper parvo and a rabies every year? Is it mold? Is it other toxins? So we talk about all that because you want to get to the root cause so that your pet can live better, so hopefully they can live longer, right? And so using nutrition, something that you're doing for them every day, can be used for that. And that's what you want, right? Other things we look at is toxin and environmental load. So we touch on glyphosate, heavy metals, chemical exposures that can really impair digestion, liver function, and immune imbalance. And it's very possible that as we're taking things away that mask these symptoms and these signs, we're seeing them. How can we help them detox? How can we lower the detox burden so that these things can work the design that they were designed to work? Their nervous system and stress. And so do they have stress in their environment? Obvious stress, or okay, let's take a step back because what might not stress you may stress your pet out. And so that affects their gut motility. That affects inflammation. That can lead to food intolerances. So looking at maybe chiropractic care, body work, acupuncture, calming their environment. How do we do that for them? These are all things that we need to investigate. And so I want to talk to you about a case that I have that, or a patient, a pet that I've been dealing with. So she came to me and we met virtually on a consult, and the dog was having, this dog is very important to her, and how most of my dogs who come to me are very important to their pet owners, pet parents. And this dog has been through a stressful time in her life earlier on, and she was having GI issues. And she came to me because of the GI issues. And she also told me, yeah, there had been some very stressful years in her life because of some dynamics. And I'm like, that plays a role. That plays a role in her gut health, inflammation. And so she decided to do homemade recipes. And it was a learning curve for her. And now she's doing great. And that is where the email support comes in. And at first, she was having some, when she came to me, she already wasn't having normal stool. And we went on the recipes, she wasn't having great stools. And I was like, hey, based on what you're telling me and everything, I think we need to add more fiber to her. And we did that, and things got better. And then they would kind of be and then they would get better. And I was like, I really think we need to test her microbiome. Allergy sensitivity testing would be great too, but we got to test her microbiome. And so that test was ordered by the pet parent. And I will tell you now that we are a month out, a little over a month out, she wrote me and she said, almost quote, is we are so much better than we were at a month ago. I'm now having her see a chiropractor because that was suggested by you to ensure her nervous system is okay, to make sure there's no, misalignments in her, which is affecting her nervous system, which is affecting her gut. And she's like, we're so much better than we were a month ago. Now, imagine had she abandoned it the first time this dog had a soft stool during all this. And here's the thing, she already came to me with GI upset. So we already knew it wasn't necessarily food, pending she's not eating something that she's allergic to. And that happens sometimes. Sometimes we don't know until we test. And so most dogs do amazing, but for the ones who struggle, we have to go deeper. We just don't walk away because nutrition is not linear. For some, it is more of a straight path than others. And for others, it is not. It can be wavy like this, even though it is in the straight line. And for some, it can be like this. And for some, it is like this, just like people. And that's because no two pets are the same. And so a setback is not a sign that something has failed. It is a sign that we need more information. It is a sign that, yes, there is something not right here. And wouldn't we rather find out now than when our pet has ongoing allergies that is requiring medication that we maybe don't feel aligned with, or a lifelong sentence of medications? And eventually these medications sometimes stop working, or there are effects on the immune system. Or how about we find out before the immune system goes haywire and we have cancer, we have autoimmune conditions, or we're overweight. There's some inflammation going on. This is why individualized support matters. This is why individualized approach matters. This is why support for you matters, because the goal is better, longer, happier lives, not a quick fix. Quick fixes don't get us there. Sometimes they are a temporary solution, but we need to find the long-term solution. And so if this is you and you're like, okay, I haven't had a consult yet, but these are things I'm navigating, I want to invite you to schedule your one-on-one nutrition consultation. And I want to invite you to come coachable, come open-minded, come with a collaborative mindset that if we hit a speed bump, we will work together to figure it out. That is why I offer email support. That is not why I just give you a recipe and say, okay, well, when you have a question, you can schedule your next consultation. That is why I'm there to help you problem solve. That's why I'm there to help you see if there is something deeper going on here. That is why I'm here to help you see that there is more than one way other than metronidazole to help support your pet when there is a flare up. That is their body telling us something is not right. We just have to listen. And sometimes listening is as simple as, oh, there's a sensitivity or allergy to this. This doesn't work. Now, if we're feeding something that is not on that list and there's no sensitivities or allergens, then we have to dig deeper. The gut microbiome, is there toxins? That the body is telling us something, and it's not just arbitrarily telling us something. That is why. So I hope you found this episode helpful. I hope that this opens your mind, whether we've had a consult or not, or you're considering a consult, or you are trying to investigate your pet's sensitivities or food issues, is that there is more to the story here. And sometimes it starts as simple as changing the food type and getting them on less processed food. Sometimes it's switching the ingredients in there because of allergies or sensitivities. Sometimes it is removing these highly processed additives. And sometimes even when we do all that, there is more to the story.